Before the 20th century, people with diabetes didn't live for long. There wasn't much that doctors could do for them. The most effective treatment was a strict diet with very low carbohydrate intake. Even then, this would only buy them an extra few years. Often people would die of starvation due to those strict diets. Now we have wonderful medicines and therapies that make our lives much easier. But one invention that changed the world of medicine and lives of those living with diabetes was insulin. This is a hormone that is naturally produced in our bodies by the organ named pancreas and allows our bodies to absorb the sugars that we consume. In patients with diabetes, something goes wrong with either the production or function of insulin, leading to high blood sugar and subsequent complications, including death over time. In 1889, two German researchers, Oskar Minkowski and Joseph von Mering, figured out that when they removed the pancreas from dogs, those animals developed symptoms of diabetes and died soon afterwards. Later research narrowed it to a single missing substance from the pancreas that was causing this problem. This substance was named insulin by Sir Edward Albert Sharpie Schaefer in 1910. Then just over a decade later, in 1921, two Canadian scientists, a young surgeon named Frederick Banting and his assistant Charles Best, figured out how to isolate insulin from dogs' pancreas. They managed to use this substance and keep a dog with severe diabetes alive for 70 days. The dog died only when there was no more of this substance left. They then developed a more refined version of insulin along with researchers John MacLeod and J.B. Collip. In January 1922, Leonard Thompson, a 14-year-old boy dying from diabetes in Toronto, Canada, received the first insulin injection, and within 24 hours, his dangerously high blood sugar levels dropped down to near normal levels. This was a major breakthrough. Eventually, this Toronto-based team developed their differences and split from one another. However, the major work was done. This news spread like wildfire, and soon multiple clinical trials and large-scale insulin production was started to treat all patients with diabetes. Just a year later, in 1923, Banting and MacLeod received the Nobel Prize in Medicine, which they shared with Best and Collip respectively. The first genetically engineered synthetic human insulin was produced in 1978, using E. coli bacteria. Today, over a century later, we have various forms of insulin and several other medications that are used to treat diabetes. We are not sure what's next in the world of diabetes, but one thing is certain: insulin was a medical marvel in the world of medicine. Don't you agree? Thank you for watching. Please like and share the video if you enjoyed it, and subscribe to our channel. We'll see you in the next video, where we will discuss other fun inventions and discoveries from around the world.